We're going to continue our conversation with Dr. Payal Kohli about stomach cancer.
He was very public about having stomach cancer. What do we know about that and the treatment that follows?
For him in particular, the combination of chemotherapy, radiation, and surgery suggests that it was probably a more advanced cancer, meaning it was probably beyond being sort of curable. And stomach cancer is a tough cancer because the surgery for it is usually what we call a gastrectomy. They cut out the stomach, reconstruct it, and connect sort of the esophagus to the small intestine. So post-operatively, the recovery is very complicated. The chemo is also very tricky. They give systemic chemo, obviously, into your veins that goes everywhere, but they can also give what's called intraperitoneal chemo, where they heat up the chemo and put it just around the stomach to try to sort of marinate.
More targeting, more specific?
Right.
Yeah.
But it's difficult. It requires a lot of procedures. And then the radiation can cause kind of ulceration of the stomach or what's left of it. And that can be really difficult with side effects as well.
So as sad as this is, it sounds like, there aren't a lot of warning signs about stomach cancer, but there's probably things we can do to prevent it.
Yes. I mean, the biggest thing about this cancer, it gets picked up really late because early in its course, it either doesn't have warning signs or they're non-specific. A little feeling of fullness after you eat, a little nausea, a little extra heartburn. So if we're older and we have risk factors, our radar needs to be up especially. And Kim, I'm glad you brought up the prevention because stomach cancer, many of the risk factors are modifiable and presentable. So worldwide, we know that H. pylori, which is a bacteria that can live in some people's stomachs, causes this chronic inflammation, and that's easily treatable with antibiotics.
And the risk factors, they have to do with lifestyle?
Some of them can. So certainly cigarette smoke can increase your risk. Alcohol, because it's kind of a carcinogen that you're putting directly into the stomach, can increase. We know for some reason men have a higher risk than women. We don't understand really why, if there's hormonal factors that are influenced. But certain foods that we eat can also influence our risk. So eating smoked foods or heavily salted foods, processed foods, less fruits and vegetables, less fiber, that can all irritate that lining of the stomach and also increase our risk.
Wow. We also were talking just yesterday, really everyone, the world was, about King Charles. And I know they're not saying what type of cancer, and we don't want you to speculate, but they were going to do something regarding an enlarged prostate that was benign.
Right.
So that's how they discover it?
Yep, and this is called an incidental finding, which generally tends to have a better prognosis because it's not a cancer that declared itself. It's just a cancer we found while we were doing something else. But he was having a prostate surgery, which is called a TURP, where they go up through the penis and they sort of roto-rooter the prostate. And so when they're down there, certainly the anus or the skin around the anus, that could potentially be something they might have seen. When they're putting the camera in, they look around the urethra. That's the tube that the urine comes out of. They go into the bladder. If you had a bladder tumor that wasn't causing symptoms, that would be something they might biopsy if they were in there. And then they examine the urine as well. And whether there's any cancer cells in there or any blood cells in there, that might suggest a kidney cancer or something else in the urinary tract as well.
It's so interesting. These are two very, very high-profile men, very public. Toby Keith, very forthcoming about his stomach cancer. The king, though, somewhat reticent at this point as to being specific about that.
Yeah, it is very interesting. And I think the sort of profile, the way that they presented themselves, to me, it demonstrates a stark contrast where if we're not talking about it, we're not raising awareness of it. And the World Health Organization recently telling us that cancer in young people is expected to dramatically increase. And so having these kind of conversations, normalizing, talking about cancer, no matter what type of cancer or who it is, I think is something we all need to get to.
Yeah, we hear about colon cancer with young people and many more to talk about. Well, maybe the royals will get there eventually. We'll see. But thank you. That was really helpful to learn more about that in light of something that is so difficult.
Yes, and of course we wish the king the best. We heard from the British Prime Minister that hopefully it's been caught early. So
yeah,
I'm
it's
really
interesting
optimistic.
how you say it might be something that could be really early, which would be good. You can find out more from Dr. Kohli at 9news.com/Dr. Kohli. Lots of stuff there. Check it out.